today's topic for disease conditions is osteoporosis. I'm not taking these chapters from textbook. It is just for your additional knowledge, just to learn about various disease conditions, how it is related to nutrition, okay? Or is there any relation to nutrition as well of different disease conditions? So starting with the chapter, osteoporosis. The bones become porous, like it loses a lot of minerals. You can see here the bone matrix is wider and bigger as compared to a normal bone, which is more mineralized. Okay, this you can see a lot of empty, big empty pockets. Okay, this is the bone density which has been lost, bone minerals that has been lost. Okay, so this is what osteoporosis is. Okay, so it causes bones to become weak and brittle. Brittle, it will easily break. A small fall can break your bones. Even your own body weight can break the bones or causes, or it may lead to small fractures in the weight bearing bones in your body, like femur, pelvic bone, ankles, feet. Okay, the bones in these parts of your body, lower um, part of your body, your spine. Okay, these are the weight bearing bones of your body. Okay, so even such a small stress like bending over, okay, you're bending over to grab something heavy, lift something heavy from the floor, okay, that could also break your bone, okay. Even coughing, excessive coughing can cause a break. So osteoporosis is related to breaks, most commonly hip fracture, wrist fracture, spine fracture. Okay, these are the fractures associated with osteoporosis. So bone is living tissue that continuously and constantly it is broken down and is replaced. If you remember, this week itself on Monday, we took a class on calcium. Okay. So in that we have discussed about bone formation, function of calcium in bone formation. So if you remember, we have discussed the continuous cycle of osteoclast and osteoblast. Okay, osteoclast will remove the minerals, osteoblast will come there and fill up, and osteoid is formed, osteoid will get filled up with calcium. Okay, so this cycle continues. Okay, when you are young, this cycle is working at a very faster rate, but when you grow older and older, the cycle slows down. Okay, so that's why uh, there is a risk of bones not getting filled up with minerals at the right time. Okay, osteoporosis occurs even when creation of new bone does not keep up with the loss of old bone. Even if the new bone is being getting formed, okay, mineralization is taking place, but it is taking place at a very slow rate. Okay, in 24 hours, you are losing more minerals. Okay, bone formation is happening, mineralization is happening, but the loss of minerals is higher as compared to the gain of minerals. Okay, so bone formation is not able to keep up with the loss of bone, so that also leads to osteoporosis. Okay, so osteoporosis affects men and women of all races, but white women, Asian women, especially older women who have attained menopause, these are the categories of people who are at highest risk. Okay, because as soon as the estrogen levels fall in a woman's body, automatically her body becomes at risk in getting osteoporosis. Okay, is it clear to all? The introduction to osteoporosis, is it clear to all? Coming to the symptoms of osteoporosis, typically in the initial phases, okay, when you are losing a lot of minerals from your body, there are no specific symptoms that you see. Okay, in early stages of bone loss, there is no specific, no pain, nothing. Okay, you look as normal as possible. Is my voice audible to all? Is it breaking? So typically in the initial stages of osteoporosis, there is no symptoms as such, no overt symptoms as such. Okay. But once your bones have been weakened by osteoporosis, signs and symptoms will start popping up. Back pain, okay, because of any broken or collapsed bone in your spine, loss of height over time. Okay, this happens in women. They become smaller in height over time. Aged women, they look much smaller than their previous 10 years or 20 years back. What was their height? They look smaller than that. Okay, so that is loss of height. Stooped posture, okay. You can see here the posture of a woman, okay, how stooped it is. Neck is forward, head is forward, the shoulders and breast chest area is forward. Okay, that is stooped posture. A bone that breaks more easily than expected, even with a small fall, trip, okay, cuff, that there could be a fracture. So these are the common symptoms of osteoporosis. Bone pain, joint pain. Coming to the causes of osteoporosis, as discussed earlier, your bones are always in a constant state of renewal. Okay, new bone is made and old bone is broken down. So when you are young, your body makes new bone faster than it breaks. As I mentioned earlier, when you are young, the bone formation is at an accelerated rate. But when you grow old, the rate of bone formation declines, putting you at risk of osteoporosis. On top of that, if your diet is also not rich in calcium and other external factors we will discuss, causes we will discuss in detail, okay, that could also trigger your bone loss. After the early 20s, after 25, okay, after the age of 25, the process of bone formation slows down, okay. By the age of 30, majority of adults, okay, they have peaked their bone mass. Okay, after the age of 30, there is no longer increase in bone mass. Okay, by 30, whatever bone mass, bone density you have made through your physical exercise, activity, through your diet, okay, by the age of 30, whatever bone mass you have made, that is your peak bone density. Okay, after that, slowly the bone mass is lost. Okay, after 30, the bone mass is lost faster than it is created. How likely you are to develop osteoporosis, it completely depends on the bone mass that you have attained in your youth, okay, and also inherit what you have inherited genetically, whatever is your ethnic group. As we have seen, in white women and Asian women, the risk is higher, okay. So these are also the other factors. The higher your peak bone mass, more bone you will have when you grow old, okay? By the age of 30, if you have really good bone density, okay, your bone density is really strong, you have really strong, dense, well mineralized bones by the age of 30, it means you do not have that risk of osteoporosis, okay? Osteoporosis may come to you, but at a very later stage of life, after 60s or after 70s, okay? You will not be hit by osteoporosis sooner. But if you have low bone density by the age of 30, your risk is high to get osteoporosis. So you have to focus more on calcium-based diet. So risk factors. Some risks which are unchangeable, you cannot modify it, okay? Unmodifiable risk, which are out of your control. Whatever is your lifestyle, these risks are out of your control. Your sex, women are more likely to develop osteoporosis than men. Okay, because the fall in estrogen after 40s, mid 40s, estrogen levels falls down. Okay, so that triggers bone loss. Age, you can't control your age. You, as you get older, everyone, men and women, both have a higher risk of osteoporosis. Then race. Okay, if you are white or if you are of an Asian descent, your risk is high. Okay, osteoporosis is not that common in Black Americans, okay, Africans. Family history, if it runs in your family, okay, parent, sibling who has osteoporosis, you also have a higher risk of a fractured hip or osteoporosis. Then body frame size small, those who already have a short stature, okay, short heighted people. below 5 feet or 5 feet or below 5 feet heighted people. In men, if it is less than 5'5" and all, okay. So they come under small body frame size. So men and women who have small body frames, they tend to have higher risk of bone mass loss as they age. Then hormone levels as well. Sex hormones, lowered sex hormones also tend to weaken your bone, even if it is testosterone in man and estrogen in women. Okay, if your body is not producing enough testosterone or estrogen, the risk of osteoporosis is high. Fall in estrogen levels in women during menopause is one of the strongest risk factors of developing osteoporosis. In men, if there is a reduction in testosterone levels in men, okay, that will also lead to accelerated bone loss in men. Body frame, that is small height. Okay, you have a small petite body frame, very thin, very small heighted, short heighted people. Okay, they have a high risk of osteoporosis. Then thyroid problem. Too much of thyroid hormone can also cause bone loss. Hyperthyroidism. Those who suffer from hyperthyroidism. Okay. Or if you're taking too much of thyroid hormone, like if you're diagnosed with hypothyroidism, your thyroid gland is not producing enough thyroid hormone, but you're taking supplements for it. You're taking hormonal replacement therapy. You're taking thyroxine tablets. If you indulge in too much of thyroxine tablets, you are overusing it or extending the use of it. That could also lead to osteoporosis. Other glands, overactive parathyroid hormones, because if you remember the role of parathyroid hormone, what it does, parathyroid hormone will take the calcium out of your bones. Okay, parathyroid hormone always want to keep a normal level of calcium in your blood. Okay, that is the goal of parathyroid gland, to keep a normal level of calcium in blood. But if blood calcium level drops, immediately the parathyroid gland will secrete parathyroid hormone to get maximum calcium out of your bones. Okay, so if the parathyroid gland is overactive, more parathyroid hormone will be produced, which will take away more and more calcium away from your bones. That will accelerate your bone loss. Also, overactive adrenal gland. Coming to the dietary factors that leads to osteoporosis, low calcium intake, lifelong lack of calcium, that also develops osteoporosis irrespective of your gender. Okay. Early bone loss, increased risk of fractures is associated with low calcium intake in diet. Eating disorders, anorexia nervosa, bulimia nervosa, binge eating. Okay. So all these eating disorders also trigger osteoporosis. Not just osteoporosis, but loss of menarche also in women. We have discussed the female athlete triad in yesterday's class, those who have attended. Okay. So if you remember, in female athlete triad, one is malnourishment, osteoporosis, and amenorrhea. Okay, that is female athlete triad. So restricting yourself from food, fat diets, crash diets, okay, that weakens your body. Then any GI surgery, okay, removal of a cancerous part of your intestine, colostomy, okay, any bariatric surgery to reduce the size of your stomach or removing a part of intestine. Okay, these so if you remove a part of intestine, you have a limited area for calcium absorption, and when there is a limited area for calcium absorption as well as other nutrients, automatically you are in a risk of deficiency. Okay, so usually these bariatric surgeries are done in grade 3 obesity, where the obesity is impacting their lifestyle. Okay, in that situation, surgery is done to remove a portion of their stomach, remove a portion of their intestine. Their diet will be completely modified and all. Okay, but in such surgeries, they will lose their weight, but they will have the risk of potential deficiencies as well. Some medical problems that could increase your risk of osteoporosis. Celiac disease. Celiac disease means if you know your small intestine has this finger-like projections called villi. Okay, these finger-like projections, villi, is supposed to absorb nutrients from the food that you eat. In celiac disease, these long finger-like projections is short, or in some places it is completely flat. Okay, and no absorption takes place. Absorption of nutrients is very poor, okay, in celiac diseases, because there is not enough length in the villi. Okay, either it is short or flat. That is celiac disease. Okay, so automatically, not just calcium deficiency, they suffer from other macro and micronutrient deficiencies as well, calcium being one of it. So since there is a calcium deficiency, there is an increased risk of osteoporosis. Then IBS, inflammatory bowel disease syndrome. Parts of the bowel, okay, that is your intestine, parts of the intestine undergoes inflammation. Okay, and if these parts are inflamed, they cannot absorb nutrients. Okay, so that would put the person into a deficient state. Kidney diseases, liver diseases, that affects your metabolism, absorption. Cancer, cancer also leads you to lose your appetite because of pain, because of the drugs, because of treatment, radiation therapy. Okay, lot of factors are associated with cancer that completely diminishes your appetite. Multiple myeloma, arthritis, rheumatoid arthritis. So these are the medical problems in which osteoporosis risk is high. If a person is suffering from any of these diseases, the risk of getting osteoporosis is high for them. Then coming to lifestyle choices. Sedentary lifestyle, people who spend a lot of time sitting, they have a high risk of osteoporosis. And if they start doing weight bearing exercise, resistance training, okay, that improves their posture, their balance. It is good for their bones as well. Walking, running, jumping, dancing, weightlifting, okay, these all are helpful. Excessive alcohol consumption, okay, that decreases the absorption rate of calcium, that puts you at the risk of osteoporosis. Arthritis means arthritis. Arth means joint. Itis means inflammation. So arthritis is inflammation of your joints. Osteoporosis means bones are porous in nature. Bones have big pores, empty pores. Is it clear? Tobacco use, smoking, okay, that also the exact association is not clear, but there is a contribution of smoking and weak bones. Coming to the complications of osteoporosis, bone breaks, particularly in your spine, your hip. Okay, even if you do small activities, small falls or trips, okay, can result in a disability. Even if it is a hip fracture and all, if you had a fall, if a person who has osteoporosis had a fall and it led to hip fracture, and if the blood vessels are involved in that fracture, it could lead to internal bleeding, and that could result in death as well, loss of uh, uh, blood, internal hemorrhage, and that could lead to death as well. Okay. In some cases, broken bones in the spine can occur even if you haven't fallen. That means if you're coughing, collapsing, okay, that could also lead to breaks in your spine. Loss of height, hunchback posture, okay, these all can weaken the bones of your spine. Prevention, calcium, okay, that is the first go-to prevention strategy. So adults who are in the age group of 18 to 50, they need 1000 milligrams of calcium on a daily basis. And after you turn 50, okay, 1200 milligrams of calcium intake has to be taken for women. And because almost by 50, majority of the women have attained their menopause. In men, after they turn 70, they have to increase their calcium intake by more 200 mg. Okay. So till the age of 50, once they, even in adolescence, okay, even teenagers have to follow the same track. In teenage and in your adulthood, up till the age of 50,000 mg of calcium on a daily basis, you have to maintain. If you're a woman, after you turn 50, increase it to 1200 mg. If you're a man, after turning 70, increase it to 1200 mg. Good sources of calcium, low fat dairy products, okay, dark green leafy vegetables, salmon, sardines. Okay, salmon is not that available in India, but sardine is available everywhere. Mackerel, sardine, okay. These are very traditional kind of fishes, small fishes, okay. And you eat them with bones. You chew the cartilages which you see in sardine, mackerels and all. It's very thin. You can actually chew and you can swallow it. It will not hurt you. Okay. So when you eat sardines with their cartilage, it has more calcium benefits as well as omega-3. Okay. Sardines are rich source of omega-3 fatty acids and calcium. Soy products like tofu and any calcium fortified products like milk. Okay, even milk in India is calcium fortified, calcium, vitamin D, vitamin A fortified. Okay, cereals and attas also, some attas that you get, flours that you get, maida, wheat flour. Okay, different flours are fortified with calcium. Okay, you can use that. On the package itself, they will mention what all minerals and vitamins they are this particular product is fortified with. Okay, then improve your vitamin D intake. Okay. From vegetarian sources, you will not get vitamin D. Vegetarians have the option of mushrooms. Okay. Mushrooms and yeast, uh, having a spirulina. Okay. Mushrooms, keep the mushrooms out in sunlight for 10 minutes and then cook it. Okay. Keep the mushrooms out in sunlight for 10 minutes and then cook it. It increases the calcium vitamin D synthesis. uh, Spending time in sun at least for 1 hour on a daily basis, but not in like the bright sun. If you want to spend at least 1 hour in sun, do it before 8 a.m. or you can do it after 5 p.m. Okay. In the peak noon time, if you are out in sun, 10 to 15 minutes is more than enough. Okay. So that's a good source of vitamin D. Sunlight, it does not give you vitamin D. Sunlight just activates vitamin D synthesis in your within your skin. Okay. But if you are living in hilly ranges, mountainous areas, this is not a good source. Overuse of sunscreen can also affect vitamin D synthesis. Then exercise, be physically active. That can make your bones be stronger for a longer period of time. And even the bone loss is slowed down. So exercise will benefit your bones whenever you start. Okay, even at late age or mid 30s, 40s, you're starting. Whenever you start, exercise will benefit your bone. Treatment, it's completely based on your risk factor. Okay, orthopedician will check your risk factors, your age. Okay, they will do the blood test. What is the level of your hormone levels? Okay, what are the other disease conditions associated with complications of osteoporosis? So these all come under the risk scanning. The doctor is able to do it. Okay, so the doctor will estimate your risk of how frequently you can break your bone. Okay, what is the density of your bone? How frequently, based on your age, gender, your lifestyle, the other disease conditions that you already have. Okay, based on all these factors, what is your risk of breaking bone in the next 10 years? Using this information, bone density test can be done. DEXAs can be done. Okay, dual energy X-ray absorptiometry, that is the full form of DEXA. DEXA scan is done to check the bone density, how dense your bones are. If your risk is high, treatment based on medications, hormonal therapy is given. But if you don't have a high risk, modify your lifestyle, modify your diet. It is more than enough to combat bone loss. Okay. But if you come under the high risk category, biphosphonates is a group of medications given to correct the bone loss. Hormonal replacement therapy in women, estrogen therapy is given, estrogen is given, and in men, testosterone is given. Okay. But there is a risk associated with estrogen. When women receive hormonal therapy after their menopause, when they still get estrogen, risk of breast cancer increases. Okay. Because your body has naturally stopped producing estrogen, but you're infusing yourself with additional estrogen that will react with your breast cells, and usually it increases the risk of breast cancer. Okay. So for the women who have not yet attained menopause, okay, only symptoms are there, severe symptoms of menopause are there. Just to control it, you can take the estrogen therapy. Okay. And or young women who know their estrogen levels are low, start including more calcium based food in your diet. You can use that strategy. If breast cancer runs in your family, don't go for HRT therapy, hormonal replacement therapy after menopause. Okay. In males, testosterone based therapy is given. Men who are not able to produce enough testosterone, testosterone therapy is given. That is the hormonal replacement therapy for men. Okay. Testosterone helps to keep the bone mineralization within the bones. Okay. It will slow down the bone loss. Then bone building medicines are given. There are different categories of that: calcium based, phosphate based bone building medicines, magnesium based medicines are there. So based on the complication, based on your requirement, the physician will prescribe it. These are the treatment available. So that's about osteoporosis. Is it clear to all?